Bismillah ar-Rahman ar-Rahim. Stress and hypertension. How to recognize, how to manage. We will talk about problem burden, role of primary health care doctors, 5 steps of patient interview for diagnosis and management of stress among hypertensive patient and also among chronic case in primary health care. The burden of mental health care is known now to be 60% in primary health care, and majority of them are not diagnosed. And it is known that it is the worst source of stress in our life, the presence of stress. In Eastern Province, Khobar study 2017, we studied the prevalence of depression and anxiety among diabetes and hypertension intensive patients and published around also 60 persons. 57 patients of hypertensive and diabetic patients are suffering from stress like depression and anxiety. So, and the good thing that the most of them is mild. And the other side, easy to be missed because it is mild, but its effect is still. We cannot manage hypertensive tension or diabetes in the presence of mental health. Either it is mild or moderate or severe. So for that, WHO cited a plan called 2013 to 2020-30, which is called MH Gap Plan, to fulfill this gap between the service in primary care and hospitals and the needs of patient. So there's gap between what is be provided and what should be. How stress affect our bodies? Stress is known to affect brain and affect our bodies through two lines, chemical and nervous system, through pituitary gland, adrenal gland, and increased cortisol. In the same time, affecting nervous system and adrenal and increase adrenaline. So hypertensive patient or diabetic patient, you cannot control it, and there's increase of cortisol and adrenaline. This is why we said in our kingdom or any place that we cannot have control cases of diabetes or hypertension. We have low cases. This is affect our cost. This is affecting our resources. Yes, because we deal just controlling the blood pressure without looking if the patient has stress or not. So look to the nervous system, sympathetic nervous system, affecting all the body, heart and nervous system within that. So it is important for primary healthcare doctor to discover if the patient has stress, mental health problem, which is mainly depression and anxiety, before managing the chronic cases such as hypertension. Otherwise, you managing the one element, but you didn't deal with the source of the problem. The source of the problem is the patient has stress or not. So it is important for primary healthcare doctor to discover if the patient has stress, mental health problem, which is mainly depression and anxiety, before managing the chronic cases such as hypertension. Otherwise, you managing the one element, but you didn't deal with the source of the problem. The source of the problem is the patient has stress or not. Thus, five-step patient interview came and deal with this issue, and this approach was approved by WHO and applied in our primary healthcare centers since 2016. Now we have around 70% of primary healthcare apply these five steps. In Egypt, alhamdulillah, applied in 2018 trial in three region, ثلاث محافظات, and approved and generalized في 2019. السوداني المجلس السوداني للتخصصات الصحية كذلك approved and trained their doctors about these steps. In Morocco, in Oman, in Emirates, alhamdulillah, now this is easy way to implement even the MH gap of WHO. So we cannot manage hypertension or the chronic disease, irritable bowel syndrome, whatever, unless we discover the stress. How these five steps work? First, is this patient suspected? Is this patient need mental health care or not? Then we screen him for hidden agenda and stress. Then defined scoping, stay with us or refer to psychiatric, then what this stress in patient is lead to depression or anxiety and how to manage it. And this approach all, it not take more than 5 to 7 minutes. So this is the beauty of this approach. It's very fast, very effective. Easy to be avoided. First thing, hypertension when it came to you in clinic, is he needed mental health care? If he's uncontrolled, yes, he is within the three groups suspected. So frequent patient, visit to primary care or hospitals, uncontrolled chronic sleep disturbance, those we our target. So uncontrolled hypertension, you mean don't just read the blood pressure, but look how to discover the stress and manage it. This is the very important issue in hypertension cases, and this is my main point. If you have uncontrolled hypertension, that means the patient need mental health care because he mostly suffering from stress. Second issue, screening for hidden agenda and for stress. Okay, what's technique we use? We use the ICE techniques. ICE is for hidden agenda and psychotic. It's mean for judgment. And this is important. If you look to a patient came 35 years old, coming to primary health care and came with uncontrolled hypertension. Uncontrolled is suspected. Then start by ICE. What do you think the cause of your uncontrolled hypertension? Immediately he said, because I am وزير البلاتينيوم وعضو في الموساد وعضو في الولايات المتحدة الأمريكية. That's it. That's mean patient has delusion. We refer him to psychiatric. They discover that he is suffering from schizophrenia and mania. Imagine this patient around 30 years running from clinic to clinic and all patient doctor concerned about blood pressure, high or not, and do investigation. And the patient is really suffering from psychotic. So we ask about uh, ايش تفتكر سبب عدم التحكم في الضغط اللي عندك؟ ايش يخوفك من عدم التحكم في الضغط اللي عندك؟ ايش تتوقع مني اني اخدمك للضغط اللي عندك بدون اخذ ديتيلز اكثر، او المريض فورس just to see if there's hidden agenda. لما يقول لك والله ممكن يؤدي الى مرض خطير ولا اخره، خلاص that's mean there's a hidden agenda. But we don't go detail in that because we will cover it later. So